Hello, everyone, and welcome to today's edition of the Manufacturers Efficiency Webinar Series, where today we're going to be discussing lowering taxes and improving employee benefits at the same time, which seems probably like it may be something that's too good to be true or that there may be some sort of catch attached to it. But I'm going to go through today and describe how that all works, why it works, and why it's allowable and within the IRS codes and kind of why this type of plan exists. So, uh, my name is Rich Bello. My company is Schooley Mitchell. It is a franchise. I'm a franchise owner based in Mercer County, New Jersey, but I work with clients throughout the US and Canada as well. Joined today by Matt Wiseman, Focal Point Business Coaching, and the other member of our group is Gina Tabasso from Barracuda B2B. She couldn't join us today. She had a late meeting appointment come up that she couldn't get out of, but she will be back with us again next month, and I will talk about that as we get to the end of today's webinar. But to get into the details of what we're discussing today, as I mentioned earlier, uh, we're talking about employer savings and employee savings that are involved with this plan. And what the plan is, which I'll mention here as a background kind of before I get into the details. But what it is a preventative care health insurance plan at its base. And it doesn't have anything to do with your current major medical insurance. It wouldn't change anything that's already in place with that type of plan. This is called a bolt-on plan. So it's meant to work in conjunction with the medical insurance that you currently have. But the way that this one is set up is done so in a way that allows for the savings that I'm talking about here on multiple fronts. You're talking about it in savings from the employer side, from the employee side, and then also in addition to benefits for the employees, which I'll get into the details of, and in addition to those savings and the benefits, one of the things that I think is most important about this plan is the impact that it can have on your your staff in terms of their happiness and their feelings of appreciation and the benefits that are being provided to them, which hopefully in turn leads to them sticking around longer. So that is a big part of the plan. Kind of the reason behind why these types of plans exist. We'll get into the details of the savings and how they're tax related, but the taxes are federal taxes. And the reason the federal government wants these types of programs to be in existence is because they want the workforce to be healthier. And the result of that, of a healthier workforce, is lower long-term health insurance costs down the road. So that's why these plans are in existence with the incentives attached to them that lead to the savings that I'm going to talk about. And the barrier of entry for this type of plan is very low. All that's required to be able to participate in this type of plan is 5W2 employees for your staff. So most manufacturers, mid-size, are definitely going to cover that. I would say even the majority of smaller manufacturers will have 5W2 employees. So as long as that is the case, then this plan is an option uh, for any type of company that meets that criteria. So we'll talk about the specifics of where these savings are coming from. And you'll see on the screen FICA, which for anyone that doesn't know, FICA is the Federal Insurance Contributions Act. And the FICA taxes, which appear as part of your payroll taxes, they essentially cover contributions towards Medicare and Social Security. So that's where that comes from FICA taxes. the rates, the federal rates associated with them, are the same for both employers and employees. It's 7.65% for both sides that contribute to FICA taxes and Medicare and Social Security. And what this plan does to create those savings is it's set up as what's known as a Section 125 in the IRS code cafeteria plan. And that type of plan you may be familiar with uh, in some of its other forms and versions. It's the same type of plan in terms of setup as a health savings account, an HSA, or a flexible spending account, FSA. Those types of plans that allow for a pre-tax payroll deduction to cover uh, the funding for those plans. So that's what this plan is as well. There's an amount of salary that is able to be deducted to go towards this plan that won't be taxed. So that the amount of salary that is not being taxed, it would be the same. It's uniform for all employees, regardless of what their overall income is. But that amount is not going to see the FICA taxes, both from the employer side and the employee side. So that's where the savings are coming from the employer side. Employees, uh, like I said, will get the FICA savings. Employees will also get their income tax savings because, again, this is a portion of their salary that is being deducted pre-tax. So that's where the savings are coming from. You may ask, okay, well, if we're deducting salary, how's this going to make our employees whole? The way that the plan works is each employee is required to take a quote unquote treatment each month. And what the treatment is basically learning that they're going to do based on their specific situation. So before the plan starts, before enrollment takes place, employees will all participate in a survey, which basically is meant to find what aspect of their health they're trying to improve upon. So whether that be their fitness, or they want to try and lose weight, or they have high blood pressure or high cholesterol, there's a multitude of different focuses that this plan could be set up around. But by taking the survey and identifying what aspect of the health employees want to focus on, the plan creates a criteria over the 12 months in the year of the plan, where each month a different either article, professional researched article, or a video about whatever health topic is applied to that specific employee, uh, they will get that delivered to them once a month. The videos are about 5 minutes, usually less, and the article, is going to be a few pages. So as long as the employee is watching the video or reading that article, they're going to get a benefit from taking that treatment, and that's how they're made whole on the amount of their payroll that's deducted as part of the cafeteria plan. So all those details, I'd be happy to get into if anyone wanted to discuss in further detail, but that's kind of how it all works and why these savings are actual savings. So to get into the benefits of the plan, and this is another really important part of it, and again, getting back to why these types of plans exist, and the incentives that are tied to them by the federal government, it's to make the employees more healthy. So you see on here, I have primary care visits. It also includes urgent care visits. It includes screenings and testings for some chronic conditions like high blood pressure or high cholesterol or hepatitis or diabetes, anything that you need to get a screening for or testing or lab work done for. It's all covered under this plan. The network of healthcare providers that are included and are available in the plan is the same network used by Aetna. So we're talking about hundreds of thousands of healthcare providers throughout the country. So chances are physicians or the facilities that you're already using are probably already covered under this plan. So no switches is required if you were to use this plan. Think talking about prescriptions, 85% of the most highly prescribed medications are included in the plan as well. So it's not just a limited amount of medications. I take a medication that is fairly uncommon and it is included in the plan. So it's a wide coverage of medications that are covered. And then the most important part of all these benefits is that all of those visits and all of the testings and screenings and prescriptions, there's $0 cost. So that means no copay, no deductible for the employees to utilize these benefits. And that's the reason why these incentives are included, because if there's no cost, the thought is employees are actually going to use these benefits and actually get healthier and stay healthy uh, by way of doing so. So, like I mentioned earlier, this does not encroach upon your major medical plan if you have one in place. Uh, what it does is reduces the amount of claims that you're putting on that plan because, yeah, it'll still be there for hospital visits or surgeries or major um, events that you need it for, but for these doctor's visits or for screenings or testings, vaccines are also covered, prescriptions, all these things your employees will use this plan for because there's no cost. Whereas, generally speaking, if they're going to their major medical, there's a copay or there's a deductible, and all of that adds up. So, with this plan, there's none of those additional costs. So, hopefully, the employees will use it, they'll get healthy, and stay healthy over the course of their usage of the plan. In terms of the dollar figures from savings from a tax perspective, it varies from employee to employee based on their income level and based on their how they're set up, like their withholdings for their taxes and all that type of stuff. So it's never going to be exactly the same for each employee, but on an average basis, we're talking about a little over $100 per month that employees are going to see added to their take-home pay. Um, can't recall if I mentioned it on the previous slide, but part of the reason that this plan is allowable and under the guidelines of IRS procedures is there is a cost to the plan for employees post-tax. So like I mentioned there's the pre-tax payroll deduction, which is creating those tax savings, but there's also a cost to the plan post-tax, but the way it works out, the tax savings from the pre-tax payroll deduction more than cover the cost of the plan. So the employee is technically paying for this plan, but the amount that they're saving from taxes still allows for a surplus at the end, which results in that, like I said, about $100 a month added to their paycheck, in addition to the $0 cost benefits that they're also getting now. From the employer side, in their FICA tax savings, it generally works out to about $550 per employee per year that the employer is saving. So for something that isn't costing anything out of pocket to see those savings, and we could do math if you're talking about a significant number of employees, that total adds up pretty quickly for the employer as well. So talked about kind of the nuts and bolts of the plan and how it works, what's included in it. I wanted to talk a little bit about how we have incorporated this plan with a manufacturer. So the example that we have, it's Old World Timber. They're a manufacturer and distributor of reclaimed wood. They're based in Kentucky. And we'll talk a little bit about how this came to be. We were introduced to the CEO of Old World Timber, kind of explained a little bit like what I've done today on this webinar, how this plan works, what it includes. The CEO was interested, so we set up a call to go through to go through it in more detail, get all of his questions answered, provide examples, more detailed examples of how it all works. And after that, the CEO was interested. He wanted to see a proposal of the plan. So from that point, we got a payroll report for each of his employees so that we could see exactly what the savings would look like for each of them. And then we were able to present that to the CEO. He was able to share it with his staff to see, so they all knew how much they would be saving to gauge interest. And then they quickly decided that they wanted to move forward. It was 100% across the board, wanted to move forward. So we were able to get that taken care of and get them all set up very quickly. You'll see the numbers here. It was 15 staff members in this company, and they were all saving, as you see, over 17,000 total, so over $1,000 per employee, and the company itself over 8,600 in savings for enrolling in this plan. Like I mentioned, the opt-in was 100%. We were able to get the enrollment going very quickly, and this whole process from the initial conversation to having the company enrolled took less than a month to do. So they were able to see those benefits and the tax savings very quickly. Just a little bit about how this process works. I kind of discussed it a little bit with that example, but the first step is a conversation with one of our FICA payroll tax specialists. Like I said, they can answer all questions, describe in depth how this plan works, all the aspects of it, and show real world examples with data on where the savings are coming from and explain it in depth. If there is interest, then phase two is for the company to submit a payroll census to us. We have a secure website where they're able to upload that information, and that's a pretty easy report to run, regardless of what payroll provider you're using. You're able to get that pretty easily, upload it, and then we're able to create the proposal from there, which shows the breakdown employee by employee, what they're saving, and how it would impact them. So that then would be presented to the company, and then the company decides if they want to move forward with it or not. If they do, then we ask them for an enrollment census, which basically is just some more detail on each employee, so we're able to get them enrolled in the program, and it kind of goes from there. So just to summarize, we all know in business and just in everyday life, costs of everything are not going down. They seem to continue to rise. So a plan like this where there's no out-of-pocket costs, it's all, like I said, covered by the tax savings created, and it's creating additional funds in your employees' paychecks. Our employees, of course, are also consumers, so they're dealing with the rising gas price and rising grocery costs. So if they're able to get a few extra bucks in their pocket and not have to pay out of pocket for their health care as much, that's a win-win. And like I mentioned earlier, hopefully that leads to better employee retention, employees that are happy with their workplace and with the benefits being provided by their employer, because we all know that losing employees is a cost in and of itself to refill that position and find a replacement that can get up to speed quickly and do a good job. So if we can prevent that, and this plan helps in doing so, then that's all for the best. Just to recap who we are, you'll see myself and Matt, Gina, as well, with all of our information included, or QR codes there. If you want to go to our websites and contact us, I'm happy to discuss this plan with anyone that sees this that has an interest in learning more. You could reach out to me there. Same with Matt and Gina, and the great information that they provide. If you've seen prior webinars that we've done as part of this series, you'll know that they're bringing great information and great knowledge in the manufacturing industry. And then we'll show the upcoming events that we have planned. Next month, Gina's going to be talking about reshoring. Obviously, a hot topic in the manufacturing industry. In August, Matt's going to be talking about the seven C's of leadership. That should be a great session as well. And then I'll be back in September to discuss opportunities to save money and cut costs on your uniforms and linens expenses. That said, I'll open the floor if Matt, if you had anything or if there was anything that I could clarify further for you, I'm happy to do so.
No, good presentation. I wasn't aware that Schoolie Mitchell delved into the healthcare side of business expenses, so that was interesting for me to learn. No, I'll just comment and say I think companies underestimate the value in um, offering incentives, kind of like some of the ones you discussed to employees, to um, motivate them to improve their healthcare, right? So, I worked for a company, a fairly large one, many years ago that they had all kinds of incentives in place for their employees. It was basically a point system. You could, in the calendar year, you could earn points by belonging to a gym and proving that you were there at least, I think it was 2 days a week. Getting your annual checkup, getting your blood work done annually, and you would earn points. And then at the end of the year, you would get, some amount of money back by taking these actions. So, the company's doing this is benefiting the employees because they're taking better care of themselves. The company has an expense because they're kicking back some money to the employees, that are taking advantage of it. And then meanwhile, the company's healthcare costs were actually going down year to year. Again, because people are taking better care of themselves, or fewer claims, and so on and so forth. So, yeah, it was a win-win all around. And I think companies really they only look at it as an expense. If they're going to add benefits to for their employees to encourage them to take better care of themselves, they just look at it as an additional cost. In reality, it's gonna it's gonna benefit them for taking, for taking advantage of that because people take better care of themselves and the healthcare cost will overall will go down.
Yeah, 100%. Like I mentioned earlier, the claims are going to be less if you're taking that preventative care action and you're taking care of yourself. So that helps everyone in the long run. To your point also about the employers, incentive to invest in employees' health. My previous job, we had our healthcare completely covered by the employer, so it was a huge benefit, and it's not really a common thing, at
No.
least not these days, with the employer covering full healthcare. And that was a huge determining factor to me when I was deciding to, start my business was where's this healthcare going to come from? Because that's something that you kind of take for granted until you look outside of it and realize, hey, now I have to pay for this. I stayed with that company for 10 years, and a big part of it was that incentive, keeping the employees healthy and, making sure that they recognize that this is something that we're providing. We hope that you use it so you could stay healthy.
Yeah. Yeah. Um, and I've attended a number of presentations recently on, other programs that are out there primarily for small businesses, really, I'll say creative, ways where they're coming up with new healthcare models, if you will,
Mhm.
that are really innovative and saving companies tons of money. So, there's providers out there that are trying to do some really innovative things to counteract these, just outrageous healthcare costs we have in this country. So. Yeah, looking into, just as a comment, I will, say to those watching that, exploring other options that are out there from, your traditional healthcare plans is very much worthwhile. I mean, I've seen some remarkable results presented by some of these newer models that are out there now, where the quality of care is no different. And in some cases, it's even with, the bigger health insurance providers. So the quality of care is there. It's just the cost is dramatically less for the employers and the employees. So, I'll just encourage people to go out and do some research on other options that are out there versus just the traditional healthcare models.
Yep, no doubt. Yeah, this you mentioned that you weren't aware that this was something we did. It was pretty recent. We just started at the end of last year,
Ah,
but for the same points that you were just making, there was an identification of the marketplace that, hey, this is a big expense for basically all companies. And if there's something that we could do to help out with it, um, then it makes sense to fit within our business model of cost reduction. So that's kind of why we brought it on. The other thing that I actually didn't mention earlier, I talked a lot about how this is a bolt-on plan to current
mm,
major medical plans. It actually still works for companies, even if they don't currently have medical coverage for their employees. So if your company is just there without offering medical benefits, this is at least something that you could start with that isn't going to cost you anything out of pocket. It's not a budget item, and it's going to provide that baseline preventative care coverage. Of course, it's not going to cover things like hospital visits or surgeries, but for those baseline preventative care visits and the prescriptions and vaccines and all that stuff, it's something.
mm.
And if you don't have anything, it's certainly it's better than that. So something to keep in mind.
Yeah, interesting. Yeah, really interesting presentation. Thanks.
Cool. Well, appreciate everyone who jumped on and joined us today. We will, like I said, be back again next month. We'll get this webinar posted up on our social media feeds, and if anyone has questions, feel free to reach out to us.